So, the next disease that we're going to talk about is age-related macular degeneration. Um, so, there are two types. You can get dry and wet. So, wet is when you're getting edema of new vessels that are growing, and dry kind of presents with drusen. So, you're going to have gradual vision loss. But with wet age-related macular degeneration, it's more of a sudden vision loss. Poor vision in the dark, and patients may complain of seeing wavy lines. So investigations, again, slit lamp and fundoscopy. And management-wise, we're going to give zinc and an antioxidant, vitamin A, C, and E, and then wet, you give anti-VEGF and photocoagulation. So you kind of get this deterioration of the macula, which is the central retina. And again, you get your dry and your wet. Dry is much more common than wet, as you can see here. So what happens in wet age-related macular degeneration is you get new vessels forming and edema due to the leakage of these new vessels, and that can lead to vision loss. And VEGF is what stimulates this vessel growth, which is why you'd treat with anti-VEGF. And whereas dry, you get this thing called drusen, which is due to lipid deposition. And you're getting thinning of the macula, which is why it can be quite hard to see. So risk factors will be age, because it's called age-related macular degeneration, smoking, cardiovascular diseases such as hypertension, family history, and being male. So symptoms you're going to get is decreased vision, poor vision in the dark. You may see flashing lights and wavy appearance of straight lines. And then, like I said before, wet age-related macular degeneration has a more sudden vision loss. So investigation-wise, we're going to want to do a slit lamp, and that can show changes to the retina. Fundoscopy, so you're going to see drusen in dry age-related macular degeneration, and more of a kind of red appearance of new, because the new vessels are forming in wet age-related macular degeneration. And you can use fluorescein to see neovascularization. So, like I said before, the management is different for dry and wet. So, if a patient's smoking, you want to encourage them to stop, regardless of whether it's wet or dry. For dry, like I said, we're going to give zinc and an antioxidant, and vitamins A, C, and E. And then for wet, you're going to give anti-VEGF, because the VEGF is what's causing these new vessels to grow. And you can also do photocoagulation.